But our top story tonight, the Delta Plus variant, a new variant, is spreading and spreading fast across the country. So far, 40 infections of the mutant have been detected, with Maharashtra once again emerging as a potential hotspot. The Union Health Ministry has already put the states on alert. Experts fear the new variant could beat the immunity acquired through infection and vaccines. But is the Delta Plus variant really more infectious, or is that being alarmist? And more importantly, will it lead to a third wave? First, our top story on the Delta Plus variant.
Delta Plus, a mutated form of the Delta variant that wreaked havoc across India, is now a variant of concern. It threatens to trigger a new wave on a nation that is still counting losses from the monster surge. 40 cases of Delta Plus have been reported in 5 states: Maharashtra, Madhya Pradesh, Tamil Nadu, Karnataka and Kerala. The centre has asked the states to be on alert. The Health Ministry has warned that the new variant has increased transmissibility, stronger binding to receptors of lung cells, and can escape immunity. The Maharashtra government has started collecting 100 samples from each district to be sent for genome sequencing.
Index cases of these Delta Plus variant should be monitored very closely. Had they taken vaccine and still got infected? So whether this Delta Plus variant has escaped the vaccine, that study is to be done. And so our department is with the help of this ICMR, ICSR and also NIV, that is National Institute of Virology. We are continuously behind that.
The earliest case in India is from a sample taken on April 5th. So far, no deaths have been attributed to Delta Plus. But experts say citizens should not let their guards down.
The concern now is that the presence of this mutation in the Delta Plus variant might render it immune from the antibodies produced by the vaccine, or the antibodies produced from past infection, or the new antibody cocktail being used in treatment.
It is not yet clear how effective the vaccines are against Delta Plus. The government, however, says the 2 vaccines being used in India are effective against the original Delta variant.
The state government says it is keeping a close tab on the present situation and taking all precautionary public health measures. For a state like Maharashtra that has been badly impacted during the pandemic, this is yet another crisis. With camera person Samir Shanbag, this is Pankaj Upadhyay in Mumbai, reporting for India Today.
As many as 40 cases of Delta Plus have been found in India. The government fears it has higher transmissibility. The experts are saying it's time for India to do a quicker tracking of the variants and mutations, and efforts need to begin to ramp up genome sequencing. But what really is genome sequencing? Because this really is the key to identifying and tracking the virus and the mutations as they spread. Sneha Mordani reports.
A network of 28 labs is undertaking genome sequencing of coronavirus in the country. Experts say India has never sequenced variants in a big way, but the second wave and now the emergence of the Delta Plus means we will have to pick up the pace.
Genomic sequencing has been restricted to research institutions in India. It was not in the DNA of our fabric to sequence clinical samples. Now the need has come, so we are tying up institutes to hospitals and bringing up the facility.
The surveillance allows researchers to examine the genome sequence of the viral strains infecting the population. Continuous monitoring of viral genome variations is very useful in tracing the path of the spread of the disease. This information can be used in deciding containment measures and strategies. Mutations can also influence the course of the pandemic by altering the properties of the virus and generating new variants. Mutations conferring immune escape are of particular concern. Currently, 45,000 samples have been genome sequenced in India by the Indian SARS-CoV-2 Genome Sequencing Consortia that was formed towards the end of 2020. However, given the country's population and case burden, sequencing numbers remain disproportionately low.
What we need is that 0.2 to 0.5% of this population will need to be screened. Now that calls for a more complex approach. We can mount a much faster public health response, which could be lockdowns, containments, tracings, and especially ICU surveillances, to look at which is that aggressive strain that is leading to the deaths in these people.
The government says that they are looking at ramping up genomic surveillance in a big way in the country. Collection of bioinformatics and data from rural India and also from places worst hit in the second wave of the pandemic is being done. They're also saying that they have expanded the network of their own labs, apart from looking at involving private labs in all of this. That conversation too, they say, has begun. With inputs from Nolan Pinto in Bengaluru, Sneha Murdani in Delhi for India Today.
So let's raise the big question on what's now becoming the next big challenge possibly in the fight against SARS-CoV-2. Delta Plus, is it a deadlier avatar or is it being overhyped? Will Delta Plus really trigger a third wave as some fear? Can vaccinations help in containing any potential new wave? I'm joined by Professor Sanjeev Krishna, Professor Molecular Parasitology and Medicine at St. George's University in London, Dr. Shahid Jamil, India's leading virologist and Director, Trivedi School of Biosciences, Ashoka University, and Dr. Shashank Joshi is member of Maharashtra's COVID Task Force. Let's first come to you, Dr. Jamil, because you worked very closely on those who've been doing the genome tracking. Now, Indian SARS-CoV-2's genomic consortia, Dr. Jamil says that Delta Plus increases transmissibility, stronger binding to receptors of lung cells, and potential reduction in monoclonal antibody response. Am I to understand that this is potentially more deadly than Delta, or the original Delta variant that hit the country in March, April, sir?
Well, Rajdeep, I don't think there is any evidence from India yet that this is either transmitting more or it is more lethal, or I have also not seen any data that it binds more tightly to lung cells. I think all that is based on the mutation that is there, and you have to understand that this mutation was first seen in the beta variant of concern, which first emerged in South Africa. So it's essentially a mutation from there, which has now happened in the background of the Delta variant of concern. So the real concern is that two key variants of concern have sort of come together. Whether this combination is going to remain neutral, or it is going to become additive, or it is going to become more than the sum of parts, remains to be studied. So, everything else at this point without evidence is simply hypothesis.
So you're saying, let me get this clear, you're saying it is too early to suggest that the Delta Plus variant could be more transmissible. You're saying it is too early to say that it could escape antibodies. However, Dr. Jamil, as you referred to it also, this variant is seen to be similar to the South African variant, which in many cases was seen to escape even vaccinations and antibodies. Is that the fear?
That is the fear, Rajdeep, but as I said earlier, it remains to be determined whether the addition of this mutation in the background of the Delta variant will cause an additive effect in terms of escaping vaccines. Now, those studies have to be done, and simply on the basis of 40 sequences, no one can make a judgment that it is more transmissible.
So can I sum up what you're saying at the outset?
We need to do some more studies.
Can I sum up what you're saying at the outset, that you're saying it is at this stage, would I be alarmist in suggesting that this could be a prelude to a third wave?
I would say this should be a matter of concern. It should be tracked, but let us not panic.
Okay,
That's the last thing we should do.
We should not panic at this moment. Let me go to London at this moment, because Professor Sanjeev Krishna from St. George's University, London seems to be worried. UK seems to be worried about Delta Plus variants. It is seen as one of the reasons potentially why the plan to lift the lockdown was extended by 4 weeks. Is there a fear in the United Kingdom that Delta Plus variant could be more infectious, transmissible than even the original Delta variant?
Thanks for having me, Rajdeep. It's a pleasure to join you. I think when it comes to Delta Plus or Delta 0.1, whatever you wish to call it, I think we should just bear a couple of general points in mind, which will, I hope, reduce a little bit some of the heat and the worries that come out in the discussions. And the first is that in general, as these variants have emerged, vaccines have helped still to prevent severe disease. And that's a very important point. And you know, as Dr. Jamil has already stressed, you know, we do need to see what's happening with this Delta 0.1, Delta Plus variant as well. There's more information really importantly needed. But the second general point, while we're all focused on vaccinations, and they are obviously absolutely central to managing this pandemic, we mustn't forget the other tools in the toolkit. So we have got, you know, other ways to reduce the risk of infection and spread. And we mustn't take our eye off that ball either. So let's think about, you know, masks, let's think about spacing, and let us now also come back, please, and consider the value of testing in limiting variants. So for example, I would suggest that in places where infections are breaking out, why not try and introduce mass testing, maybe involve companies testing their employees regularly, rather than you know, just focusing on the vaccine questions.
Interesting. Your observations are interesting. I'm going to come back to some of them, because you're telling us how to prepare, in a sense, in case this mutant turns out to be more infectious and transmissible. But Dr. Shashank Joshi, interestingly, Delta variant that hit us in March, April, allegedly responsible for about 77% of the cases of COVID 2.0, began in Vidarbha, in Maharashtra. Now, even Delta Plus seems to have originated or emerging, let me put it, seems to be emerging in different parts of Maharashtra, Ratnagiri and Jalgaon. Not Vidarbha this time, but Ratnagiri and Jalgaon. How worried are you? The government yesterday has said it's a variant of concern. How worried, and more importantly, how prepared is Maharashtra for Delta Plus?
Rajdeep, thank you. One thing is very clear. Lessons learned from the second wave made us do a joint collaboration with the Institute of Genomics and Integrative Biology of the CSIR and Government of Maharashtra. And as early as April, from 36 districts of Maharashtra, every week we picked up 100 cases. And from that genomic surveillance, we picked up a cluster in Ratnagiri, which is 20 plus cases. This evidence is anecdotal. All these 20 plus cases are fine. They have now passed more than 4 weeks. Most of the cases were mild to moderate, and that is what it appears. And probably the transmissibility in that little cohort of anecdotes of 20 plus cases is probably little less. So that is the observation. Now, obviously, as Dr. Jamil and Dr. Also from UK has said, that this is too scant an evidence for us to make an observation. So from the same Ratnagiri cluster, we have picked up a larger genomic sample, which is currently being analyzed as the IgIB. And we will have data in another week or 10 days, which will give us further answers to this question. So one thing is very clear cut, that this is appearing to be a homegrown strain. And one thing is also there, that this probably may not be a Delta plus, but maybe a Delta minus. But we need more data. Without this data to raise off an overhyped alarm, may be a little alarmist. At the same time, we can't be off guard, because we are seeing a very dramatic result in the metros where people have stopped masking, people have started crowding, congregations are happening, cloud clusters are happening, which is very detrimental to public health. So having said that, we need to keep our genomic surveillance, regressive testing in place, but there is no complacency from COVID appropriate behavior or protocols. So clearly we have a concern, but at the same time, we cannot afford lax about it.
Now, I just want to understand and get clarity once again for our audiences. You're saying that in the 20 cases that were detected in Ratnagiri, all of them were mild and moderate, right? So there has been no, as far as you are concerned, there is no reason to believe that this is necessarily more infectious than what we saw in March and April.
See, it's too small a sample size for us to make it. So at best, I would say this is an observation which is anecdotal, which will need further validation with more testing. That is what the early, this is early data. So early data is very reassuring.
Okay, early data is reassuring, but Dr. Jamil, there was a belief that in February and March, either we got our genome sequencing wrong or we didn't prepare for the second wave, even when alarm bells were being rung by a few scientists, the government at the time seemed to remain complacent. The citizenry was off guard. Do you believe what are the big lessons we can learn now in the month of June from what we failed to do maybe in February, March when Delta variant 1 hit us?
Well, one obvious lesson is that if science provides you evidence, don't look the other way. Don't, panic, but, follow the evidence and follow the scientific method to confirm the evidence. And here I might add that, I am aware of the capabilities of IGIB. And I'm aware of the arrangement that the Maharashtra government has with them. It's a very good arrangement. And it is because of that arrangement that we were able to pick it up very quickly. And it's really a tribute to both that institution and the government of Maharashtra that they've been able to do that. Now is the time to really find out how much it has spread. And, the good thing with this is that you may not have to do whole genome sequencing to find out whether it is Delta plus. Public Health England has developed a genotyping assay, which can be done far more quickly and and much cheaper. So, our labs are perfectly capable of developing a similar assay. We should do that, and we should, get the evidence at scale. That's the only thing to do.
But Dr. Jamil, as we saw in the month of February and March, suddenly the cases seemed to increase exponentially. And then we were struggling to track them. Is that one lesson in a way that we have to learn from where we went wrong in February, March, that the tracking has to be much more vigorous, as has to be the testing?
Absolutely. Yes.
So do you think we've learned that lesson, or are you hopeful that we've learned that lesson, Dr. Jamil?
No, I think we have learned that lesson. I mean, the response that I have seen over the last 2 or 3 days, it looks like the pendulum has swung the other way.
Yes, in fact, yesterday morning, the health secretary called it a variant of interest. By the evening, it was already a variant of concern. So I just don't know. I think the government has gone from being complacent in February, March, now to sort of ringing the alarm bells all too early, but maybe that's the way to go. I'm just trying to understand, Professor Sanjeev Krishna, what can we learn from the United Kingdom in this regard? Is there a lesson that we can learn when the way the UK has been tracking Delta 1 variant in particular? Today I'm told France and Germany have also raised alarm bells over Delta.
Well, I think many of the lessons have been mentioned and they are worth repeating. And one of them is very much the need to acquire appropriate genome sequence analysis from these variants. And the second thing is to obviously follow how these variant genomes are behaving, both in the community, epidemiologically, and then with individual patients, what sort of disease they cause. And then when you can get data on how, if at all, they are escaping from vaccines. And that is really, if you see changes that are relevant in those areas, in terms of spread, in terms of disease, and in terms of vaccine escape, that's when you can really say, look, here we have something that's a variant of concern. But let's not forget one thing, Rajdeep. This is not going to be the first time, or the second time, or the third time that we're going to be discussing variants of this virus. And I think we must just look at things and say, well, look, what can we use that is already there and that we know works irrespective of variants? And those are the tools that we must put into place. And I come back to what you said, that mass testing, really testing now effectively to make a diagnosis and then implementing containment procedures, a COVID-appropriate behavior, that has to be emphasized again and again at government and at state level.
You mentioned, of course, COVID-appropriate behavior, but let's be clear, the UK is a smaller country than India. I mean, Maharashtra itself is larger than most European countries, and that, Dr. Joshi, leads me to the point that there is this pressure to unlock. There is the pressure to unlock a Mumbai. At the same time, there is the fear and concern about potential variants, more variants emerging, more mutations taking place. How are you going to ensure COVID-appropriate behavior while unlocking at the same time?
So, Rajdeep, the only answer is to vaccinate, vaccinate, and vaccinate. I think behavioral change is very difficult. Behavioral change is mandatory. We need to have zero tolerance for non-maskers. We need to have zero tolerance. But, we have seen that it's very difficult to implement. So I think we need to unlock, we need to have 3 yardsticks. Apart from having a test positivity rate of less than 5% for more than 2 weeks, 70% of the geography has to be vaccinated before we mindfully unlock and allow crowding situations. So I think there is no role for congregations or for crowding at all till such time we have vaccinated at least 70% of the geography. So unless and until we do that, we can allow economic activity. Livelihood is as important.
We are at 5%. 1 minute. You're telling me that Maharashtra can only unlock when we reach 70%. We are about 5-6% only at the moment in terms of vaccination. It's going to take a minimum of 6 to 8 to 9 months, some would say. It could be even longer. So are you saying that Maharashtra will have to remain under some kind of lockdown, or indeed other parts of the country, till 70% of that part of the country is vaccinated?
No, I think, Rajdeep, I would not agree with that. I think we will get vaccines. I think, even today, Maharashtra has vaccinated a large proportion, and we will get at least, according to me, 20-25 crore vaccines a month. And I'm quite confident that in 3 months, we will vaccinate a substantial proportion. We need to do sero surveys. We need to see the exposure, and we need to shrink the susceptible population. If we are able to shrink the susceptible population for the red zones aggressively and appropriately, and we need to keep on harping on COVID-appropriate adherence to protocols and behavior, we will be in the next 3 months in a much better shape than what we are today.
The worry of...
I'm optimist.
Okay, you're an optimist. You're hopeful that in 3 months we'll be in a better place. But Dr. Jamil, and I come back to the South African example because Delta Plus is seen to be similar to the South African variant that caused such concern in that country and across the world, that will vaccinations work with it? That's the question that some are asking. Will the AstraZeneca vaccine in particular work with Delta Plus?
Well, Rajdeep, the real world data with Covishield coming both from UK as well as the CMC Vellore study in India has shown that Covishield will protect very effectively against severe disease and hospitalization. If your benchmark is symptomatic infection, then that's the wrong benchmark. I think data is now very clearly showing that even a single dose affords up to 70% protection for the Delta variant by Covishield. So I don't think we have to really get too alarmed with this. We are yet to see whether this additional mutation, which is, by the way, just one of those mutations found in the beta variant, whether this additional mutation changes the ability of this virus to escape significantly more. So I think this is the time to do those studies and start with laboratory studies and then move on to population studies. At this point, population studies can't really be done because there isn't enough in the population.
But what you're saying at the moment, but till those studies are done, Dr. Jamil, there will be, people today are already getting alarmed. You're seeing the newspaper headlines already. Delta plus variant is amongst us. Even with 40 cases, it seems that because we were over complacent in February, March ahead of the second wave, now we've gone to the other extreme, as you said. Now, do you believe that we need a more balanced approach in a sense till we get more information?
Well, I mean, it's but natural that once bitten, twice shy. It's very natural. But I think I think we should pull back a little on this alarm and get more information, get more evidence. Policy really needs to be driven by evidence. That's very, very important.
Policy needs to be driven by evidence is what you're suggesting. In conclusion, I want to ask you, Dr. Joshi, first, is Maharashtra in terms of infrastructure, God forbid, if these cases rise exponentially as they did in March, April, I'm only giving the worst case scenario, are we better prepared in terms of hospital infrastructure for more hospitalizations if they were to occur?
Absolutely. We are completely prepared, both in terms of hospital infrastructure, people who will man those hospitals, as well as in terms of equipment and medications. We are definitely mindful of all the facts, and we have taken the worst case scenarios, and we have ensured that, God forbid, if this happens, we will be definitely much better equipped to handle the third wave.
Dr. Krishna, should we be calling it a third, this whole thing of wave after wave, as you said, variants will keep coming. People would like to know, do you believe that with every wave, the hope is with more people vaccinated, especially the vulnerable groups, the waves will be less deadly rather than being more deadly?
I think that what you've emphasized is completely correct, Rajdeep. I think that if you look at Israel and now if you look at the UK, the emerging evidence is clear that as the vaccine programs really take a grip on the population, there is now a difference between the number of cases of COVID and then the number of hospitalizations. There is a split. So cases may be going up, but hospitalizations and deaths remain relatively low compared to the past. So even the word wave starts to change its meaning. And I agree with you that, we should be looking at this perhaps slightly differently. And going back to what I've suggested is looking at the whole toolkit, because you need to throw everything at this virus, at this pandemic, until you are confident that you are on top of it. And that may take a long time.
Dr. Jamil, a final word from you. You said don't panic. Is there any other recommendation that you give our viewers as they listen to this conversation?
No, I think have faith in people who are managing this, have faith in people who are doing the sequencing. I know that we have a lot of capability. Just have faith in them. Don't panic. It will be dealt with.
Don't panic, it will be dealt with. You understand, Dr. Jamil, when you say that, people still, the memories and the scars of what happened in April are still fresh.
Doesn't matter. Past is past. Look ahead. Look to the future.
Okay, that's a fair way to look at it, an optimistic way to look at it, that don't panic at the moment with these reports of Delta plus variant. 40 cases reported, but still no clear evidence that it is more transmissible necessarily or more infectious. I appreciate my guests joining us. Always good to have experts on these issues. Thank you very much for